Hello, I'm Dr. Beth Godey.
And I'm Dr. Martha Leatherman. I'm a geriatric specialist in psychiatry.
And I'm a neuropsychologist, and I specialize in aging.
We're experts in dementia care, and we're here to provide you some information and answer some questions that we hear very commonly about dementia and other issues in aging. Hi, today you might want to move any young children. We're going to talk about sexuality in elders and elders with dementia. And it's no secret to anyone who lives in this society with our media blitz that older people, in fact, do have sex. They have intimate relations, and there are medications that address these things. There are all kinds of resources. But when dementia becomes a factor for someone, then that is a complicating issue. And I know that you have had situations, especially in your support group, where that's been a real heartbreak for couples.
It really is. In one instance, the husband goes with his wife to the psychologist or the neurologist, and they tell him that she has Alzheimer's. And unfortunately, a lot of healthcare providers will put into terms like this. They'll say, well, your wife has Alzheimer's, and it's almost as if she has the brain of a child or much younger teenager or something like that. And that kind of phrasing is very difficult to accept. And as we always say, we never want to portray people who have dementia as children. We talk about it in terms of how the brain functions. But imagine being a husband and being told that your wife has limited brain function and is behaving, or her brain is behaving as a child.
She's childlike.
How do you justify having sex with a child? Mm-hmm. So it becomes, even though that's not really the case, that she really isn't a child, but the husband was very disturbed because then he felt very guilty and almost like a pervert in his sexual needs and his sexual affection toward her. So that's one issue that comes up, and it can be heartbreaking. And so that's one of the first issues. The other issue is the issue of the frontal lobes that we've covered a lot with dementia, and the changes in sexual behavior in someone with dementia who has frontal lobe disinhibition, as we've talked about.
Which we're going to talk about in the next segment. But this issue of being a child or childlike, any physician or psychologist professional who says that is not trying to use the wrong words, and they're just really trying to help explain the brain function in a way that people can get a handle on. But one of the things you need to understand is that a person with dementia may have the reasoning capacity of somebody much younger, a child, may have the calculating ability of a grade schooler. But emotions are different, and years of a relationship of love, of being a sexual human being in that relationship does not get erased that way. And so not all of the functions of the brain get sort of rewound back to childhood. So the spouse is still very much the spouse in many, many meaningful ways.
Right.
Even if some functions, cognitive functions, are diminished. And if you have a loved one, a husband or wife with Alzheimer's, don't feel like you're stepping outside the boundaries in terms of sexual affection, because that's a part of a relationship. And relationships in Alzheimer's continue until really the very end.
That's true. And we've talked a lot with our patients and families about the power of touch and affection. It can be comforting, it can be calming. All kinds of sexual interactions, all kinds of touch can be such a nice way to show that you still love the person, you still care about them, that they're safe, and that they're needed and wanted, and that can go a long way.
Especially when words are gone, when
Right.
words are difficult to find and to understand. Touch is a powerful communicator of things that you can no longer put into words with somebody with Alzheimer's.
We don't often think of touch that's not pure sexual intercourse as being sexual, but it can be brushing the hair, massaging the hands with cream. Any kind of touch like that makes it more of an intimate situation.
So we hope you found this helpful. Thank you. For more answers to questions like these, our book, The Insider's Guide to Dementia Care, is available at Amazon.com.